Historically, Oklahoma's agency tasked with helping people with mental illness and addiction issues has been underfunded. This year, the governor is asking the legislature for a big hike in money to pay for treating addiction and mental illness. In this It's Your Government segment, we look at the work done by the Department of Mental Health and Substance Abuse Services and the challenges the department faces.
Does mental illness conjure up images of disheveled men and women aimlessly wandering along downtown sidewalks? Does the term substance abuser bring to mind a drunk or meth user sitting stoned on a curb? The State Department of Mental Health and Substance Abuse Services is charged with being the state's safety net for people with mental illness or addiction. Its Commissioner Terry White says the face of addiction and mental illness is different than many people believe.
The face of mental illness and addiction looks like me, looks like you, looks like our brother or our sister, our friend or our neighbor.
Oklahomans have the second highest rate of mental illness in the nation. Our second leading cause of workforce absenteeism is untreated mental illness. And our state has one of the highest rates of prescription drug abuse.
I'm good, thank you.
Mental illness and addiction are diseases.
Diseases that can be treated without putting patients into big state psychiatric hospitals, as was once the custom. In the 80s and 90s, hospitals like Griffin Memorial in Norman were closed or scaled back in favor of inpatient or outpatient treatment in local communities. Michael Brose, the executive director of the Mental Health Association of Tulsa, supports community-based care.
And it's an investment in the community. It's just much less expensive to provide people high-quality substance abuse care, high-quality mental health care in the community and keep people stable. They have an opportunity to work, pay taxes, be law-abiding citizens and what have you, but they need access to care.
The Department of Mental Health and Substance Abuse Services contracts with private, not-for-profit agencies to provide community-based services.
Only 2.7% of our budget is actually spent on administration. Over 97% of the dollars, the taxpayer dollars that we receive, are out in local communities preventing mental illness and addiction or treating mental illness and addiction, which means we're saving Oklahomans' lives.
Still, many Oklahomans, especially those relying on state help instead of private insurance, don't have easy access to treatment. There's a shortage of providers and facilities. White says that means 80% of youth with substance abuse issues don't get the help they need. 70% of adults needing mental health or addiction treatment can't get it in Oklahoma. And 40% of school children have untreated mental health issues.